Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now. Hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video. Hi everybody! How are you guys doing? Isang panibagong nursing lecture, nursing discussion nga ang alay ko sa inyo for today. Kumusta kayo? How was your week so far? Way mid through this week. I hope everything is safe and fine and doing great. Not fine, but great with their lives. Maraming salamat po sa pagtutok nyo sa upload ko last Monday. Thank you so much. And today, like I promised, today is all about nursing procedures and skills. And like you see on your screens, this is all about blood culture sample collection. Your ultimate, yes, when I say ultimate guide, eto na talaga tayo. Now, if you haven't watched the other videos I created under the playlist of nursing procedures and skills, I actually have a lot. You guys, it's for free. Use them, all right? And don't forget to share them also to your friends. Sa mga nagre-ret them dyan, nag-oral revalida, you might as well brush up your knowledge regarding some procedures and skills. All right? So, now, before I further proceed, I would just like to welcome all the new subscribers. As I am filming this video right now, we're currently at 18,454 subscribers. Wow! Wow, you guys. And currently, our views increased to 12.8 thousand. Wow. And for the past, past 3 days, I had more than 247 new subscribers, and I want you to understand that I really appreciate all of you guys. Welcome to the channel. And sa mga datihan ng students, to the oldies but goodies, yes, welcome pa rin, and mahal na mahal ko kayo. Thank you for your love and support. Now, let me just share to you some statistics I found out on our channel. Did you know that 56.2% of you guys are not subscribed to my channel? There's a way for me to find that out. 56.2 of people who are watching my channel are not subscribed. And I do not understand, why are you not subscribing? If you find my contents helpful, beneficial, it helps you in any way, why are you not supporting the channel? Because here, let me tell you why. You have to support my channel. The bigger the subscriber grows, the bigger the channel gets, the more video quality, the more educational contents I can deliver, the bigger contents we can create. Who knows, we can invite some speakers on our channels, do some one-on-one interviews regarding research, all of that about nursing. Help me make this channel as bigger as it can get. And I assure you, you will not regret that you give me your support. I really want to use my platform for all the nursing students and nursing professionals, because I want this channel and this platform to help you, to be in service in regards to, giving you latest updates, refreshing your knowledge about nursing, education, in all aspects of nursing, in all subjects across nursing. I want this to be your number one online go-to resource every time you want to look for something that you come across in nursing. And none of that will happen if you will not support the channel. So please, subscribe and subscribe from you, and a notification bell. Making sure that you hit the notification bell will really a big help to the channel. So do it now. O, diba ang bilis lang? That's very quick. It doesn't give you like less than 5 seconds to do it. Come on. So like I said, this is all about blood culture sample collection under your nursing procedures and skills. Now let's jump right into it. Blood cultures detect the presence of a bacteria in the blood or bacteremia and the systemic spread of such infection or septicemia through the bloodstream. Blood culture sample collection involves collecting a venous blood sample by venipuncture at the patient's bedside and transferring the sample into two bottles, yung aerobic and anaerobic bottles natin. One containing the anaerobic medium and the other anaerobic medium. Anaerobic medium, ibig sabihin, something to do bacteria that cannot live or can live without oxygen. Right? Aerobic medium meaning those bacteria that needs oxygen to survive. All right. So the bottles undergo incubation, which encourages organisms in the sample to grow in the media. If possible, blood culture sample collection should occur before antimicrobial therapy begins because antimicrobial therapy may interfere with bacterial growth. Kasama to sa septic screening na ginagawa sa hospital. If the patient is having fever, subsequent fever o naglagnat ang pasyente mo, automatic maglalaran sila ng septic screening kasama yung blood culture sampling, urine ANA, urine CS, nasal swabbing, all of that to rule out where's the infection coming from. Right? Right. So let me share to you the objectives for our today's discussion. I'll make sure that at the end of this conversation or this lecture, you'll be a master of blood culture sampling. All right. So let me share to you the objectives. Of course, I'm going to give you introduction, equipment, implementation, special consideration, collecting blood culture samples from a central venous access catheter, complications, and documentation. O, diba? Kasi sa lecture na to, I'm gonna give you a discussion or a step-by-step guide on how you will take blood culture sampling from peripheral and from central venous access catheter. Paano yung mga pasyente mong naka-central line? May jugular line, may PICC line, may femoral line. May mga ganon. So, don't worry because I got you, girl. I got you. Eto na tayo. Let me share to you the introduction. Introduce ko muna sa inyo ito. Alright, so blood culture samples collected from central venous access catheters are associated with higher false positive rates. So you should collect blood culture samples by venipuncture. However, you may use a central venous access catheter if peripheral site isn't available or if you suspect a catheter-related bloodstream infection. If you suspect such an infection, draw one set of blood cultures through the device and one set from the separate venipuncture. This is to rule out peripheral, kaya sinasabi ko sa inyo, peripheral or what you call this, or through the central venous catheter. Alright, blood cultures from the catheter and venipuncture should be positive for the same organism, and the patient should have associated clinical signs and symptoms and no other recognized source of infection. A positive culture from only the device most likely results from a contaminant, and the patient shouldn't receive treatment. This is a big no. So very careful ka sa pagle-label mo. Huwag kayo mag-alala. Tuturuan ka mamaya. So, niraran ito, like I said, to rule out as part of your septic screening. All right? So, that's just a brief discussion of your blood culture. Mag-proceed na tayo. What are the equipments? So, preparation of equipment. You have to inspect all equipment and supplies. If product is expired or is defective or has compromised integrity, remove it from the patient use. Label it as expired or defective and report the expiration or defect as directed by your facility. That's just how you are going to prepare for the materials that you need to use. But in terms of the equipment, let me give them to you. All right. So what are the things that you have to use? You have 2x2 or 5 centimeters by 5 centimeters gauze, pads, alcohol pads, antiseptic agent, alcohol-based chlorhexidine, preferred or a diaphor such as povidone iodine or 70% alcohol, depending on the policy of your SOP of your hospital. Appropriately sized syringes. Normally, itong isang bottle na ito, nire-require nila yan for 10 ml of blood each bottle. Yes, depende pa rin yan sa protocol nyo. Okay, but normally 10 ml po per each bottle. So you need 10 cc syringe. Kailangan mo rin dyan. Kung magpe-peripheral ka, you need what? A butterfly. Ba, hindi tusok ng tusok, day. Ito na tayo. Blood culture bottles, aerobic and anaerobic bottles. Important. Gloves, labels, laboratory biohazard transport bag, yellow bag, and your transport bag, yung sinasend sa labs, needles, needle-less transfer devices, small adhesive bandages, winch or butterfly or straight needles. Optional po, laboratory request form, single patient tourniquet, sterile blood culture collection kit, sterile gloves. Sterility po, kasi sterile procedure ang collection ng blood culture. Diba? You don't wanna introduce organisms to the sample, to the specimen, by you not keeping the sterility of your environment. Okay, because that could create false positive. What result? Baka mag-antibiotic ang pasyente mo bigla. Wala naman siyang infection. Gigigil ako sa iyo. Ito tayo. So, malinaw tayo sa equipments. Mag-proceed na tayo sa implementation. How are you going to implement your blood culture collection? Ito na. Ito ay for peripheral. So, first, you have to verify the practitioner's order. Very important. Gather and prepare the necessary equipment and supplies. Wala ka namang order, nag-blood culture ka. Anong gigigil ako sa iyo? You have to gather and prepare all necessary equipment and supplies. Rationalization to save time and effort. Kambubing. Perform hand hygiene. Sterile technique ito. Cross-contamination. Remove any form, any cross-contamination. One way to do that, the best way to do that actually is to do hand wash. Confirm the patient's identity using at least 2 patient identifiers. Kung unconscious ang pasyente mo, gamitan mo ng ID band. Gigigil ako sa iyo. So, 2 patient identifiers depende or 3 full names and MRN o yung ID number ng pasyente mo. Next, provide privacy. Tell the patient that you need to collect a series of blood samples to check for infection. Explain the procedure to the patient and family if appropriate according to their individual communication and learning needs to increase their understanding. Allay or ally their fears and enhance cooperation. Explain the procedure typically requires 2 blood samples collected from 2 different sites. All right. So this is to increase patient cooperation, decrease their stress level and anxiety level. All right. Eto na tayo. Raise the bed to waist level before providing care to prevent caregiver back strain. Period. Self-explanatory. Huwag ka masyadong dyan. Next, perform hand hygiene ulit. Ni-raise mo yung bed, naghugas ka ulit ng kamay bago ka magpatuloy. Nakita mo? Yes. Next, put on gloves to comply with standard precautions. Depende pa rin ito. Kapag naka-standard ang pasyente mo, standard precautions, so gloves tayo. Gloves, yes. And mask. Kapag naman, bawa airborne or contact, kailangan mo ng full set of PPEs or droplet. May 95 ka na doon. Okay? Yon, depende sa kaso ng pasyente mo. Malinaw ba tayo nun? Mag-continue na tayo. Eto na. Now, if the patient is receiving an infusion, choose a venipuncture site opposite that extremity. Huwag kang syunga. If the venipuncture must be performed on the extremity with an infusion, use a vein below or distal to the site of infusion. Avoid venipuncture of the side on the of the axillary node dissection and in the upper extremities with lymphedema or compromised circulation. Also avoid venipuncture on extremities affected by radiation therapy, decreased sensation, paralysis, or hemiparesis from a stroke. You don't want to take your samples from affected side. Kung may mga ongoing infusion yan, wag doon. Gigigil ako sa iyo. When possible, restrict venipuncture to the dorsum of the hand in a patient with an actual or planned dialysis fistula or graft. Opposite side ng AVF. Yung ginagalaw yun. Next, avoid using a tourniquet if possible. If the tourniquet is necessary, apply it. So proximal to the area chosen for the venipuncture and limit tourniquet time to less than 1 minute. All right? Prepare the venipuncture site using an antiseptic agent, alcohol-based chlorhexidine preferred. If contraindicated, use an iodine povidone solution or 70% alcohol. Hindi mo gagamitin yung iodine mo sa mga pasyenteng allergic sa iodine. That's why you have to rule out. Baka magka-allergic reaction ka pa, girl. Apply using a single-use sterile applicator. Allow the solution to dry completely without fanning, whipping, or blowing, because if you're gonna do that, you're just gonna introduce the bacteria that is present in the air. You don't want that. Okay? Next, for alcohol-based chlorhexidine, apply with an applicator using a vigorous side-to-side motion for 30 seconds. Allow the area to dry completely as shown on, wala akong picture na nilagay. Dapat may lalagay ang picture dyan. For povidone iodine solution, apply using a swab. Begin at the intended venipuncture site and move outward in a concentric circles. Paikot po. Center to outer in a circular motion. Do not reuse the swab, or the gauze. Do not do that. Allow the solution to dry completely, typically at least 2 minutes. Don't palpate the site again to avoid transferring microorganism to the venipuncture site. If palpation is required, put on the sterile gloves. Malino ba yun? Very simple, right? Now, before ko i-proceed itong discussion ng implementation, baka hindi ka pa nagsasubscribe, mag-subscribe ka na, go. Thank you so much for doing that. Mag-proceed na tayo like promised. Okay, eto na. So, disinfect the diaphragm tops of the blood culture bottles with alcohol pads and allow them to dry. Avoid using iodine-containing products because they can degrade the diaphragm tops. So, you can disinfect this one. This is what I'm talking about. Once you open it, disinfect it with alcohol swabs. Don't use iodine iodine solution kasi baka mamaya ma-degrade niya or masira niya yung integrity ng diaphragm tops. May rubberized kasi itong top nito. Okay? Alright. Next, if you are also drawing blood for other laboratory tests, draw blood for culture before drawing the sample for other tests. Blood culture first bago yung ibang mga blood test. Dawa, may CBC, may PTT, may nag-run din ng, iba pang blood serum, blood serum orders ang doktor mo. Unahin mo muna yung blood culture. Huwag mo ilalast ito. Okay? Perform a venipuncture using a straight or winch needle. If directed by your facility, discard the initial volume, 1.5 to 7 ml, of the blood samples to prevent induction of contaminant organisms contained in the skin. Then draw the quantity of blood that's sufficient for the isolating organisms. 10 ml per blood culture collection bottle. What did I tell you? Yes, normally standard po 10 ml. Follow the manufacturer's recommendation for blood sample volume required per bottle. Now, if a tourniquet was used, remove it immediately when blood begins to flow. Alright, so why do you have to remove the tourniquet? Para maiwasan yung blood clot. Blood clot kasi yan. Masisira yung sample mo. So kapag nakakuha ka na, may backflow na, once na insert mo na yung tip ng needle, remove mo na yung tourniquet. Alright, normally yun yung mga mali ng mga nurses. Hindi nila nire-remove yung tourniquet once na may backflow na, kapag nag-aspirate na sila, para maiwasan rin yung hematoma. Alright, next. Divide the blood by injecting the appropriate amount into each blood culture bottle using a needleless transfer device to ensure the most accurate culture results. Now, place 2x2 gauze pad over the puncture site, taking care not to contaminate the needle, and remove the needle slowly and gently from the vein. From the vein. Apply the gentle pressure to the site for 2 to 3 minutes or until bleeding stops to prevent extravasation into the surrounding tissue, which can cause hematoma. Then cover the site with small adhesive bandage. Label the culture bottles in the presence of the patient to prevent mislabeling. Include the patient's name and identification number and date and time of sample collection and the contents of the culture bottles. Now, ang ginagawa to, normally, nagpaprint ng stickers, patient bedside, patient identification. Identify mo muna yung pasyente mo, We'll print the stickers, right? Dito sa facility namin, that's what we do to avoid what's this? Patient identification error. All right? Next, mag-proceed na tayo. Malapit na talaga to. Ang dami, di ba? One by one. Oh, ito na. Invert the bottles gently 8 to 10 times to mix the blood adequately with the medium inside the bottles. Discard syringes and needles in a venipuncture or in a puncture-resistant sharps container. Sharp box. Discard used supplies in appropriate receptacles. Return the bed to the lowest position to prevent falls and maintain the patient's safety. Balik mo sa dati. Remove and discard your gloves. Oh, linis ka na. Nagto-terminate ka na ng procedure mo. Perform hand hygiene. Place the samples in a laboratory biohazard transport bag and send them to the laboratory with appropriate laboratory request form, if necessary, within 2 hours of collection. 2 hours after collection kasi wala na, may bacterial growth na yan, girl. Now, 5 hold samples at room temperature. Never refrigerate or freeze them because doing so may kill some microorganisms. Just transport them right away. Perform hand hygiene. Document the procedure. Alright, malinaw ba tayo? Tapos na tayo ha, basically sa implementation. Mag-proceed na tayo sa special considerations. What are the things that you have to be mindful of? Eto po siya. Alright, so use blood conservation strategies when drawing blood to reduce phlebotomy-related blood loss. Ay yung hospital-acquired anemia. Baka naman sobra-sobra na kasi yung blood mo, 10 ml lang per each bottle, which is a major cause of hospital-acquired anemia. What did I tell you? Collaborate with the laboratory staff about the minimum volume of blood required for each test. Per hospital, normally, may minimum naman yan. May SOP sila. Maximum 10 ml, yung iba 7 ml or 8. Depende pa rin sa protocol nyo. I suggest that you coordinate with your laboratory. What is the required minimum or maximum or required level of blood samples for your blood culture taking. Now, if a patient has suspected sepsis, obtain blood culture samples before administering antimicrobial therapy to optimize identification of pathogens and improve outcome. Antibiotic therapy should be delayed to obtain blood culture samples. Bago mag-start ng antimicrobial therapy, magraran muna ng blood culture. Kasi mamaya, alam mo na yun. Common sense. Nag-antibiotic ka na bago ka mag-blood culture. Wala na. Hindi mo muna in-identify yung organism. Pinatay mo na muna sila. Whatever. Next, if the patient has no obvious source of infection and you suspect a vascular catheter-related bloodstream infection, withdraw 1 set of samples from the distal lumen of the catheter and 1 set of samples peripherally. Meaning, kadalasan ito ganito. May ganitong order. Makikita kang 4 na order ng blood culture. Aerobic, anaerobic. And then aerobic, anaerobic. Pag nakakita ka ng ganon, pagtanong ka, ibig sabihin, 2 sets of blood cultures. 1 peripheral, 1 doon sa central venous catheter kapag may central line ng pasyente mo. Okay? So, yon. Tapos, importante yung labeling. Okay, mamaya, tatalakay natin yan. Wow. Next, proceed na tayo sa collecting blood culture samples from a central venous access catheter. This is what I've been talking about. Normally, yung mga pasyente namin sa ICU naka-central venous line. So, nako, matindi din discussion ito. Ito na, hindi madali lang to. Now, ito na, isa-isayin ko sila sa inyo. Hindi ko na iulitin yung verify the doctor's order, hand hygiene, collect all equipments, kasi matik na yon. Ipuproceed na tayo doon sa pinaka-juice, okay? So, ito na. Stop all infusions for designated period depending on the patient's condition. Research hasn't established the length of time for stopping fluid flow. One study suggests a wait time of 10 minutes after stopping the infusion before obtaining the sample. So 10 minutes. Ito ay base sa research lang naman. Now, perform hand hygiene. Hindi pa rin mawawala. Put on gloves to comply with standard precautions. Clamp the catheter to prevent accidental exposure to blood and to reduce the risk of air embolism. Change the needleless connector microclave. of the lumen that you'll be using to obtain the blood culture samples to reduce the risk of contamination and false positive results. So, kung naka-central line, mag-ready ka na rin ng mga microclave mo para palit lahat. Perform a vigorous mechanical scrub of the needleless connector for at least 5 seconds using antiseptic pad. Allow it to dry completely. Gaano katagal ang vigorous scrubbing? 5 seconds. This is according to Lippincott. Antiseptic pad. Alcohol swab. Ganon. Tapos na tayo. Ang bilis, diba, ng central access. Yun lang. Ano ang mga posibleng complications ng iyong blood culture sampling collection? Eto, hematoma, most common. Tinalakay natin yung kanina. Sample contamination and false positive results from improper technique may lead to inappropriate antimicrobial use. So very careful ka dito. These are the most common complications. Now, malapit na tayo matapos. Before tayo matapos, bigay ko sa inyo yung documentation nyo. Mga dapat nyong i-document. Yung nurse's notes nyo. Unlabeling. Mag-subscribe ka muna, uy. Thank you. Now, let's proceed. Documentation-wise, ito yung mga dapat mong i-document. Date and time of the venipuncture. Venipuncture site. Volume of blood you collected. Venipuncture site meaning peripheral or central. Specific laboratory tests. Patient's tolerance to the procedure. Teaching provided to the patient and family if applicable. Their understanding of the teaching. Health education. Tapos na tayo. Ay, hindi pa pala. Any need for follow-up teaching? Gusto ko na tapusin, dahil. And basically, that was it for your documentation. Alright? Very important yung magle-label ka, ha? Ilalagay mo dun sa actual na bato, peripheral or central, para alam ng mga taga-lab kung alin to, ano ba to, saan ba to kinuha. Ganon, very important yon para may identify nila, may identification. Alright? Thank you so much, you guys, for watching. Hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics you want us to do. Comment it down below. Abangan mo nga i-upload natin this coming Friday because it's going to be amazing. It's another nursing drug study. Diba? Amiodarone po ang tatalakayin natin. So, maraming salamat po sa pagantabay, sa pagtutok at pagsuporta. Thank you very much. Don't forget to follow me on all my other social media accounts. Everything is at Neil Galve, except for my TikTok account, which is Neil Galve Official. Tulungan mo na nga ako. Ipamalita mo na sa radyong sila ang pinakabago, pinaka-fresh at pinakalibreng nursing review center sa balat ng YouTube. And I'll see you again on Friday. You have a good one.